So this exercise is something that encourages the ability to control your trunk, basically, and to be able to control moving into a flexed position. I'm going to show you a couple little subtle variations, but it's a great exercise. It's sort of an advanced sitting technique, but it's also wonderful for trunk control, and there's a lot of really cool things you can learn from it. So I'll try to explain as I go. So what you want to do is you want to get into a bent sit, okay? And there's different variations, but essentially what I'm going to show you first is called bent sitting position. So you're just bending these, flexed. Now, to start with, what you want to do is grab a hold of your knees. You got two ways to get there. You want to get in a nice upright sitting position. You can do it either by grabbing the knees and sort of lifting the chest. Think nice long neck, chest to the ceiling. We're in a nice upright sitting, right? Because this position makes you want to collapse. So you try to get to a good starting position from here. So it can be hands on the knees, pulling yourself up. Or your other option is to post and use your arms. But for this example, I'm going to do knees, hang on to my knees apart, okay? Now from here, what I'm going to do is one vertebrae at a time, and it's really the pelvis that controls this, okay? So you're going to do one vertebrae at a time, starting from the bottom, allowing the pelvis to roll back, introducing a subtle flexed position into your back, okay? So here it is. It's like we're upright, and we roll one vertebrae at a time. So here it is. One vertebrae, there. That's all I got right there, okay? Then I can return by using my arms and pulling myself up, which is what I just did, or one vertebrae at a time, roll it down, or use your abdominal muscles to pull yourself back up. Now, a couple really crucial things. First off, if your back is very sensitive, this is something that sometimes you want to modify a bit, okay? Here's what you don't want to do. When you roll the pelvis back one vertebrae at a time, don't pull your chest down with it. So it's not a pull the top down, it's allowing the pelvis and everything else to roll backwards slowly, okay? And the neck and the head and everything tries to stay nice and tall and towards the ceiling, and you're allowing yourself to roll from the bottom up, okay? Now, other positions, you can also learn, put one leg down. You can learn to do it in this position, okay? So it's a half bent sit, either side. It can even be legs more relaxed, and you learn to do it here. But ultimately, you want to get where you can do it in this position. And what this does is teach you really good control of sitting. Don't pull the top down, just tuck the bottom under. One vertebrae at a time. And this is one that's really good to work with your therapist in terms of how to control this and what the sequence that would be smart for you.